Mental health matters, even if people don't think so or feel like it's not important. In fact, mental health and well being are as important as physical health and wellness and should be given the same consideration at all times. Mental health issues such as depression, anxiety, and suicidal thoughts are serious topics that affect millions of people worldwide every year. To reduce these effects, it's important to understand the causes and get proper treatment. Well, feeling sad or nervous for no apparent reason is sometimes manifested as changes in appetite or weight, panic attacks, trouble sleeping, forgetfulness, or thoughts of committing suicide. Well, if a patient presents at your clinic with such complaints, you need to ask them 5 important questions. And these questions include: first, you need to ask the patient about changes in appetite, fatigue, dizziness, changes in sleep or sexual activity pattern, thoughts of suicide, including how strong these thoughts are and how you might commit the act, change in bowel habits, changes in weight, changes in your menstrual cycle, forgetfulness, unusual thoughts such as obsession or fear, crying frequently, palpitations, excessive sweating, tingling of lips or fingers, and whether the feeling of nervousness or extreme fear tend to occur at certain times, during certain events, or in certain places. Secondly, you should know if he has any of the condition like mental illness, alcoholism, drug abuse, sexual or domestic abuse, any chronic disease, past suicide attempts, and history of severe trauma. Now, one more important question that you need to ask is about if there is a history of mental illness or suicide in their family. You should also question your patient about any recent changes in his life, such as in his job or finances, and whether he had just quit smoking or suffered any personal losses like the death of a loved one. Now, a question that you're supposed to ask your patient, and you need to ask them to all of your patients, is about their medication history. Because the condition that they're experiencing currently might be due to adverse reaction of any of the medication. So, in this particular case of depression and anxiety, you should ask if your patient is taking any birth control pills, methyl dopa, steroids such as prednisone, rezorpine, antidepressants, sedatives, thyroid pills, amphetamines, or beta-blocking agents such as propranolol, which are often used to control high blood pressure, because many of these drugs can cause depressive symptoms. Now that you're well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination will include a mental status exam in which you will ask your patient if he knows where he is and other questions related to the memory. So now if you're clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of depression, anxiety, and suicidal thoughts. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.